Hi, this is a note trying to explain the importance of indicating to the radiologist when there are focal symptoms. So this patient came in. I noticed that they had had hand radiographs about 2 weeks ago as well, and the tech note was filled out exactly as it ought to be. There was the views were correct. The history given was follow-up for hand injury, and that is good history, but it doesn't really tell us what their symptoms are, right? They had an injury, but presumably they have pain, and it would help to know where their pain is. Now, maybe it was global. In fact, my assumption, given the fact that there was no other indication in the note or on a marking, my assumption was that there was global pain. But in fact, if you look carefully, there is a little step off here in the base of the fifth metacarpal bone, and on the lateral view, you can see there's a step off. So there's a non-displaced fracture there. And I looked back at the prior study, and sure enough, it was there then too, but it was not called. And I think that the reason it's not called is it's a subtle finding. It's hard to see it, and it would be very helpful if the area of pain was indicated. So I looked in the clinical notes, and sure enough, if you look at the time of the injury, and again on today's note, the doctor who saw the patient said they had point tenderness right there. That's where their pain was. So what I would ask techs to do is, when you're talking to the patient, just like you might ask anybody, your friend, when someone says, "Yeah, I fell on my hand and it hurts," you say, "Does it hurt in a particular place? Can you point to it?" The can you point to it is a great question, because if they can, then they will, and you should mark that site. If they point to this area, then by all means mark it and say this is the area of the pain, and that would help us to find these things and make diagnoses more accurately. And if not, then you don't mark it. Then you just say, well, it's more generalized pain, so you don't have to. We don't have a specific place to look, but it's a clue that's so easy to ask. Can you point to where it hurts? And if they can, then you've got something that can really help the radiologist and the doctor who's seeing the patient as well. Thanks.